Okay, let's move on. And Dr. Cole, great topic here in this segment because it's happening to so many of our athletes out there, especially young athletes, the changes to practice and games in regards to COVID and how that has potentially increased injury, overuse, simple sprains and strains. Are you seeing this right now because of the change in seasons and high school athletes, youth athletes coming through the door, and because everything's got to be shaken up because of COVID?
Yeah, it's interesting because we're seeing sudden transitions from being inactive to active. And about 2 months ago, I saw more elbow fractures and skeletally immature baseball players than I've seen in like 5 years. It was the weirdest thing. And now maybe it was coincidence, but the point is that there were a number of young athletes that were pretty quiet, and then they are just chomping at the bit to get back to sports, and then they get back and within very short order have an injury. I've seen the same thing with some soft tissue injuries, hamstrings, and so forth. And I'm even starting to see an uptick in ACL injuries that are happening very early in the return to sport process, much earlier than you would normally see. So I do believe there's an effect on this relative inactivity, detraining, and so forth, that we're seeing an uptick in certain injuries for sure.
We've got a great guest on the line, an expert from Ivy Rehab. He is one of the clinical directors at Ivy Rehab in Northbrook. Ivy Rehab does a great job with so many locations around our area. Eriks Zusevics is with us, and Erik's background primarily in sports medicine with a focus on high school athletes. So Eriks, thanks so much for joining. And that is Erik with an S, correct?
Yeah, you got it. Thanks so much for having me, guys. But correct, it is Eriks with an S.
Good, because our listeners have been going, Steve, why are you always saying Erik? Isn't it Erik? It's Eriks with an S, so I got to clear that up right away. But hey, tell us about your current role, Eriks, and how it pertains to the care of young athletes returning to play.
Sure. So I'm a sports med physical therapist. I'm the clinic director here with Ivy Rehab in Northbrook. Aside from being the clinic director, I work with a couple soccer and lacrosse clubs through our partnership, Sports Made Personal. Those clubs include FC United, Trevian SC, and Team One Lacrosse. So primarily, I would say 75+% of my current caseload are these student athletes that I'm seeing right now. And in regards to specifically Dr. Cole's points right now, too, we are definitely seeing an uptick in these patients right now in the clinic, in these high school and even middle school athletes right now, secondary to, I would say, due to COVID.
What are you doing now that's, with respect to return to sport? What are some of the assessments that you're doing to sort of assess readiness for these athletes after they've had an injury or even after they've had surgery?
Yeah, so I think the important thing there is to assess a couple things. One is I think it's imperative that we assess eccentric control. And when I talk about muscles moving eccentrically, that's essentially the ability to kind of control muscles, right? A lot of times we talk about, just lifting weights concentrically or such too, but eccentric control is the ability to load, specifically running, jumping, this kind of thing too, which puts a lot more strain on muscles. So that's one thing I really look for. The other thing is injuries usually happen during fatigue, correct? So it's good, great, and grand when some of these guys are going out for maybe, let's say, 5-10 minutes and they're feeling great after an injury, but we want to assess how they're feeling after a game and such too. So our goal here in clinic is to put them through a vigorous program in order to determine if they're ready to go back to play. And what that entails is putting them through a strenuous cardiovascular program too, and then again, looking at plyometrics and eccentric activities right now to determine if they're ready to go back.
I mean, to that point, are you fatiguing them and then testing them? Because I think that's been an area that we have not really engaged in. We do these time equals zero tests, but we haven't really done exactly what you said, which I think is critical because most injuries happen later in the game, except for what I'm describing now in this transition from inactive to active. And there are certain injuries that are really fatigue specific. Do you do testing in a fatigue state?
Yeah, usually at our later stages. For example, right now I have it was a simple knee contusion, but unfortunately he had a significant amount of blood within his knee, and now he's actually getting back to hockey. Well, he's just started to transition into running, but still that doesn't necessarily make him ready for a true return to play full-time at practice. So what I've been doing with this athlete right now is, just like you said, running him through a cardiovascular program, whatever that may be, whether we throw them on the treadmill at a certain time, we throw them on the elliptical, having them do a significant amount of strengthening exercises. And then at that time afterwards, we're going to look at his kinematics in regards to the loading, the jumping, and such, because at that point, then we can truly assess, well, does his muscle have that muscular endurance? Does he really have that strength to return to a full 60-minute game?
Visiting with Eriks Zusevics. He is a clinical director for Ivy Rehab in Northbrook. I'm Steve Cashel with Dr. Brian Coe. You're listening to Sports Medicine Weekly here on 670 The Score, coming your way each and every Sunday morning at 7 a.m. Central. Eriks, you brought up cardiovascular before. Have you seen significant cardiovascular concerns with kids who may not have been active?
You know, I think this is always, as we know, lack of, or inactivity, I should say, that's always going to change our cardiovascular endurance. We know based on current research the significant detriments that it's going to affect our VO2 max just with a few days, if not a week of just inactivity right now, too. With this specific population, where we have to realize, again, they're kids. Hey, they're able to get back out on the field. They're just going to go full go. Well, if they haven't been practicing for such a long time, no doubt that they're going to have some cardiovascular endurance concerns, which, again, may present a potential risk for further injury. They're tired. They're out on the field. They're not really thinking about it. They're trying to go full go because, hey, they've been out for so long due to COVID. They're going to try their best right now. But if their muscles don't have, and I always use this term, the fitness of muscles, right? Because the body always has to have, the muscles always need to have a certain amount of fitness to adequate to certain activities, right? Your muscles need to have fitness to be able to play in a full 60-minute game. So if these muscles don't have the fitness, if your cardiovascular system doesn't have the fitness, that may present potential risk for injury.
Okay, great stuff. We're out of time. Eriks Zusevics, again, clinical director, Ivy Rehab. Eriks, before we let you go, best way to get a hold of you guys and at Ivy Rehab?
Sure. You can just look us up on the internet, Ivy Rehab, and specifically our Northbrook location. Another very easy way to contact myself is that you can shoot me an email anytime, simply at sportsmedicine@ivyrehab.com.
Ivy, I-V-Y, ivyrehab.com. Hey, that's great. Eriks, great stuff. Continued success with you and your patients and the people you work with, and thanks so much for joining us here on Sports Medicine Weekly.
Great. Thanks so much, guys. Have a great one.
You too. We're going to take a break here on our show. When we come back, it's our Ask the Doctor segment. You're listening to Sports Medicine Weekly only on
670 The Score.